3 of those 9 are linked to known outbreaks and complex cases. 6 are under investigation by our public health team, and 2 cases were reclassified. There are no new reported deaths today. There are 30 Victorians in hospital. 3 of those are receiving intensive care, and 2 of those 3 are on a ventilator. Those numbers continue to fall, and that's great news for those individuals, but also great news for our team of dedicated professionals across our health system, given how challenging it is to treat COVID patients and just how infectious this virus is, leading to many health workers becoming infected themselves. 2,754,516 test results have been received since the beginning of the year, which is an increase of 9,023 since yesterday. That is, all of you I know have been following weekend trends where numbers do fall off a bit, but that is a good strong number, certainly better than our performance last weekend. So I thank those more than 9,000 Victorians who went and got tested. It's so important that we have the most complete picture of where the virus is, how it's spreading, and also just at a very personal level, if you have symptoms, you get tested, we can support you, your family, and we can help you to not spread this virus to anybody else. Really very important. Please don't delay. If you've got any symptoms whatsoever, please go and get tested. There's more than 200 sites across the state. The results come back, 95% of them within 24 hours. And arguably, it's the most important thing that you can do if you've got any symptoms at all. There are 29 healthcare workers who are active cases. We thank them for the work that they have done and do, and of course we extend those thanks to all of their colleagues. The 14-day average to 4 October is Metro 11.6 cases, regional 0.3 cases. The mystery cases to the 2nd of October, Metro 13, regional 0. In terms of the Metro regional split, there is 1 new case from today in Shepparton. So that's 1 new case across all those local government areas that are under the 3rd step restrictions, and the Chair will speak to that case in just a moment. That means the total active cases to the 5th of October are 4 in regional local government areas, so 4 active cases. Now, I just wanted to take you through, just very quickly, some data in relation to our Call to Test program, which is a very important way that we can get support to those who, for whatever reason, can't make their way to get tested themselves. So this is as at 5 p.m, the 4th of October. There's been, in terms of inquiries made, there's been some 5,504. 2,918 of those have been eligible for a test. There's been 1,544 tests that have been scheduled, and 1,300 of those tests have been completed. We do know and understand, though, that there might be a need for us to go a little bit further in regional Victoria. So despite how strong those numbers are, we're working on whether we can expand this program a little further into regional Victoria, so whether that be the hours that it operates and or the number of people who might be eligible. We want everybody who's got symptoms, regardless of their circumstances, to be able to get tested. We get their results, and that's how we can protect them and indeed the entire community. So that's a really important part of our testing program, but I think it can be strengthened even further, and that's why there's some work going on in the next few days to see if we can't increase the number of people who are eligible and increase the number of people who can get those tests. In terms of aged care active cases, there are 77, so that number continues to fall, and we're very pleased, given the underlying vulnerability of those settings, to have that lower number. It's still of concern to us, and aged care will always be, until we get a vaccine, a very challenging setting, and one that we have to work very hard on, and we absolutely are, and I'm very pleased to acknowledge the partnership with the Commonwealth Government and the partnership between the public and private sector. It's serving us well, despite the very significant challenges that we have had. Disability facility settings, just the 1 case. I think I've reported that 1 case a number of times now. They'll drop off once the case is closed. That's 1 staff member, and I think that pretty much that is the numbers for the day. I want to now ask the Deputy Premier and Education Minister to take you through some very important and exciting announcements in terms of kids getting back to school. This is really important, I know, for families right across the state. but it's got to be done in a safe and steady way. And I'll now ask James to take you through the decisions that have been made, and then Brett can speak to the sort of epi picture across the data that I've shared with you today, and then we can take any questions you've got.